Hello everyone, I'm Dr. Sonal Agrawal. I'm a pediatrician and an allergy and asthma specialist. I've been a pediatrician for over 20 years now, and I thought I'll share with you a few of the tips that I give to the parents. Today we are going to talk about newborn period and mainly newborn feeding and stooling. Our bundle of joys actually would be sleeping cumulatively around 16 plus hours. But whenever you talk to any parent who's had a baby recently, they usually feel like they're feeding the child and changing the child all the time. So let's talk about the feeding. Breastfeeding we know is the best for the child. And I tell to all my mothers, the newborn mothers, please take care of yourself. Take care of your nutrition. Take care of your fluid intake. And of course, very importantly, take care of your posture when you're breastfeeding, because a lot of mothers will have upper back ache or lower back ache if right posture is not taken. So always make sure you have a backrest when you're feeding the baby, and if you want to use a nursing pillow, that helps too. Now let's talk about how long you want to feed the baby and how often you want to feed the baby. The baby needs to be fed usually every 1.5 to 2.5 hours. And when the baby sucks, there are two kind of things going on. One is the baby sucking for feeding, which we call nutritive sucking. And then babies also use the mouth to explore, which is called the non-nutritive sucking. So you want to keep the feeding simple, keep it about 15 minutes on each side with burping in between, and that does take away the danger of keeping the baby on for too long, which ends up in sore nipples for the mother, which can be very painful, and it also will hurt the baby because you will not be able to feed the baby that often later. So while you're feeding the baby, a lot of times it happens the baby goes to sleep. The baby finds it warm, comforting, and falls asleep. So at that time, I would ask you to wake the baby up by gentle patting and burp the baby and try to get the baby to feed again. If we do this, we get a little bit more regular pattern of feeding, and that gives the baby some time to sleep as well and not get hungry that soon, and it gives some time to the mothers also to rest and produce more milk. Let's talk about stooling. How often, what color? When the baby is born, they usually have a dark green to black stool, which is called meconium, and it's okay to have the meconium and or a blackish color stool for the first 2 days of life. After that, the stools are usually any shade of yellow, any shade of deep green to lighter green to brown, and these are all okay. The stools that I would worry about and I would want every parent to talk to the pediatrician about is if you have a bright red stool, which I am sure a lot of you will be talking to your doctors about, maroon stool, black stool, or even a very light whitish stool should be brought to the attention of pediatrician. Babies can have a stool several times a day. There are a lot of babies who will have a stool after each feed. And then there are babies who do not have stools for a couple of days, even 4 to 5, 6 days. As long as they have a soft stool at the end of whenever they are stooling, it's completely normal. So please do not worry, and you can wait a few days if the baby does not have a bowel movement. I hope these answers some of your questions and queries. Please follow my other videos to get more answers to frequently asked questions about newborn and infant period. Thank you.